Hey guys, it's Heather. I hope everybody has been having a great summer. It has flown by. It's, the very end of July right now, so summer is really coming to a close, only a few weeks left. I enjoy summer, but I'm not a huge summer person, so especially being in nursing school, and since we have a break, I'm ready for summer to be over so that I can get, finish with my studies and everything like that. But anyways, I had gotten a really good request from my Facebook page on that type of video to do. Somebody had requested that I do a day in the life of a labor and delivery nurse video, and I thought that was a really good idea. I'm obviously not a labor and delivery nurse, but I thought based on my clinical experiences this semester, I could start doing some videos kind of like what my experiences in clinical is that day, like what my duties as a nursing student in those different specialties are, and then maybe just kind of talking a little bit about what I see the nurses doing on a day-to-day basis. So in our level 3 we have peds, OB, and mental health, so I'll definitely be able to do a day in the life for like an OB, labor and delivery nurse, a pediatric nurse, and then a mental health nurse. So look for those coming, this fall and everything. I'm excited about doing those, but I did want to go ahead and do one, kind of on that same topic, and I'm going to be doing one, talking about one today of a day in the life of a long-term care nurse, because that is what my experience has been so far. I also actually just accepted a new job with a hospice company. I'm working PRN at my other job, obviously, and I need another PRN job to supplement just because there's not very many shifts available. So yeah, so I'll be doing a day in the life of a hospice nurse as well once I finish my training and start working there for a little bit. But anyway, so basically this is going to be a video about what I do on a day-to-day basis in a long-term care center. So basically, there are different, types of long-term care centers, the types of patients they'll accept, the type of just general patient populations you can have, just different ways that they're run. In Texas, something that really sets them apart is that we use medication aids. So you won't find the nurses at many places in Texas responsible for all the treatments and being responsible for all of the med passes. That just doesn't happen. I see a lot of posts about stuff like that on the website that I talk about a lot, called allnurses.com. Nurses asking questions: how do I finish my med pass to my 50 residents and do all their treatments and everything like that? And I completely sympathize with nurses who have to do that. I can't imagine what your shifts are like. But anyways, so basically, when I come in, I work on a skilled nursing unit, so we have a mixture of long-term care residents who need skilled nursing care, and then we have a mixture of Medicare residents who are usually there for shorter stays. They've just gotten out of surgery. A lot of, patients who have had ORIFs of their hip or something like that. So patients that are going to need a lot of rehab and a lot of education to hopefully make it to where they don't have that same injury. Usually that injury is resulted from a fall at home. So yeah, basically what I do when I come on shift, it depends on whether I'm working the morning shift, which I get there at 5:45 if I'm working the morning shift, or if I'm working the afternoon shift, and that means I'll get there at 1:45. If I am working the morning shift, I come on, I clock in, and I get report immediately from the night nurse. If I come in for an afternoon shift, what I do instead of getting report is I go ahead and I make my rounds on all the patients. That's just because, once it gets to be that afternoon time, it might have been a little while since the day nurse had a chance to check on all the residents. She's been running around doing, a lot of different things, and the residents just might not have been checked on in a little while by the nurse. So I always like to make sure that I check on all the residents, not to mention in the afternoon, you're not quite sure where all your residents might be. They could be out on paths with family, they could be in the game room playing bingo, or they could be in their room napping, they could be visiting with somebody else in the dining room with another resident, something like that. Whereas when you come on in the morning, everybody is in bed still. They're either asleep or they're just now starting to get up for the day. So that's kind of a difference between when I come in for morning and night shift. But after I check everybody, when I come on for the afternoons, I go ahead and get a report. If it's morning shift, like I said, I've gotten a report, and then I go and I check on all my residents. Usually I'm just peeking in their rooms, making sure they're still in bed, they're breathing, everything like that. I try not to disturb them. A lot of people do get up pretty quickly after I get on shift in the morning, but I do like to let them sleep as long as possible. Morning shift, the first thing after that I do is I go and I find all my residents who are diabetics and who need AccuChecks, because those residents need to have their blood sugar checked before breakfast. This facility doesn't have a lot of insulin dependent diabetics. Most of them are on oral oral meds, but if they do need any kind of insulin based on a sliding scale, or they have a routine insulin coverage needed, then I'll give them that too based on what their AccuCheck was for the day. After that, a silly thing that you might not think of having to do is I have to go around and make sure that everybody who has hearing aids has their hearing aids. Hearing aids get lost so easy in nursing homes, it's unbelievable. So most places have it to where the nurses keep the hearing aids on their cart, and we have to sign in and out the hearing aids in the morning and then at night. So I go around and I make sure that all of the residents who have hearing aids have their hearing aids for the day. After that, it's just kind of random things that I need to be done. I'll pass out newspapers. I might help out getting somebody up. We have one patient who has a peg tube, so I have to do his feeding before I go into the dining room. With people that have peg tubes, obviously medication aides are not able to give them their medications because it has to go through a tube. So anytime you have a resident that has a peg tube, the nurse is responsible for giving them their meds, even if you do have a med aid. So in the morning I give him his feeding and I give him his meds. He also, most people with G-tubes, peg tubes, whatever, they need to have a dressing around the tube just to decrease any irritation or to absorb any leakage that they might have. So I always change the dressing in the morning too. So that takes up a pretty good chunk of my time in the morning before I have to go to the dining room. So usually by then, those are my main duties. That gives me about an hour and a half to get all that done. Like I said, the vast majority of my time is taken up with feeding my resident with the tube. And after that, it's about 7:30, so it's time for me to go to the dining room. Most long-term care facilities will require that there's a nurse in the dining room. You're supervising, making sure everybody who usually comes to the dining room is in the dining room. You're checking all the tickets to make sure everybody who is supposed to have certain dietary requirements is being met. People that are supposed to have pureed diets get their pureed plate. Mechanical soft, they get their mechanical soft plate. If anybody needs thickened liquids, just kind of stuff like that. It's also just in case anybody chokes, somebody there that's, available to do CPR. We've had people fall in the dining room before, unfortunately. So just somebody there just to monitor everything. And that takes a good 30, 45 minutes, just kind of depending on what's going on for the day. After breakfast, it's time to just get started on all the treatments. It depends on what kind of residents you have, but you'll have a variety of treatments due throughout the day. Usually put on a specific schedule. One of the things that's usually due right after breakfast is breathing treatments. Usually that's done with a nebulizer mask that the patient wears over their face like this. You have to go in. I always make sure to listen to their lung sounds. I check their oxygen level and make sure that they're breathing normally, everything like that before I give their breathing treatment. Give them their breathing treatment. Usually takes about 10 or 15 minutes depending on how many medications they need. Sometimes I might need more than one, and just how fast they're breathing in general. After it's finished, I go and take it off of them. I'm doing other things in between that time though. I can't just stand in there with my resident, unfortunately. I would like to be able to do that, but it's just not possible. But yeah, after that's done, I reassess their lung sounds and their oxygen level, and I go on to my next thing. A really big portion of my day is doing like wound care. We have a lot of residents who unfortunately get skin tears, stuff like that. So I'm going around checking skin tears, making sure they're healing okay, changing dressings, and then just general wound care. We'll have people that have, pressure ulcers or just some general kind of open wounds. A big part of that also, besides the wound care and other, duty that I have to do is I have to go around and chart on all patients that are on antibiotics, patients who have had a new skin tear, patients who have fallen, and then our Medicare residents. So that involves going around to each of those residents, getting a set of vital signs, and doing a thorough assessment on them. Medicare, it's a whole total assessment, you know, from head to toe for people that, you know, maybe somebody is on antibiotics for a UTI. It's a more focused assessment, asking them if they've had any pain while urinating, if they're having any flank pain, encouraging them to continue drinking fluids, making sure they don't have any adverse reactions to the antibiotics, anything like that. So it just kind of depends if they have a, you know, bronchitis or upper respiratory infection, listening to their lung sounds, making sure they're not coughing anything up, and just really making sure that, you know, you're getting a good assessment of them and making sure that their symptoms are starting to subside. And if they're not, you're letting the doctor know that something else is going on. Like I said, with Medicare residents, it's a whole entire focus assessment, listening to heart, lungs, bowel sounds, cap refill, peripheral pulses. Like I said, a lot of our patients are hip patients, so making sure that their wound looks okay, their surgical wound, staples are present if they have staples, edges well approximated, no signs and symptoms of infection, you know, peripheral pulse is palpable, like they don't have any excessive edema, you know, just really, you know, general nursing assessment and writing out a really good nursing note about that patient. After that, it's probably time to go to the dining room again for lunch if we're on day shift. For night shift, it's really the same things. It's just you only have one meal to deal with. And usually most of your like breathing treatments and stuff will be due like in the evening, like 8 o'clock or something like that. So in between that time, it's kind of flipped a little bit. You are doing all your wound care and your assessments and everything like that before dinner. Then after dinner is when you do AccuChecks. Well, actually, you do AccuChecks before dinner and after dinner, but you're most likely giving, you know, like Lantus and stuff like that before bedtime, Levemir, one of the long-acting insulins. But yeah, then after that, you're just kind of taking care of things. Every day is different. It really changes. You could have somebody fall, or you could have somebody get a new skin tear. You have to notify the doctor. You have to notify the family. You have to write a nurse's note about it. You have to do skin checks every day, which is where you just go and completely assess somebody head to toe of their skin. They usually give you 2 or 3 patients to do that on, making sure they don't have any new bumps. I always tell the patients, making sure you don't have any new bumps, bruises, or open areas. One thing I always make sure to check really good is their backside. I mean, that's where you get the most of their pressure ulcers. They're in bed a lot. They're sitting in wheelchairs a lot. That needs a really good, thorough assessment. I always ask them too, do you feel any sore spots on your backside? Just because you can kind of take a quick glance and maybe they have something kind of hidden somewhere and you need to take a really, really good close look. But yeah, a lot of it's, you know, just addressing patient concerns as well. They might have something that's a new behavior for them. You might need to notify the doctor about. You notify the doctor about a lot of things here and there. Somebody's having trouble with their pain, it's not working. Somebody's got a new cough, you know, stuff like that. It's really a busy, busy day every shift. I'm never bored. I never have time to sit down, really. I honestly hardly ever take a break. It is an exhausting day, but at my new facility, I honestly really, really enjoy it. Interacting with the patients is always fun. They're always sweet. They always have interesting stories to tell. You do have a couple of honorary residents, that's for sure, but they make your day interesting, and you just kind of learn that that's who they are at this point in their life, and you just kind of take them for who they are. Another little things, addressing family concerns, just kind of trying to answer their questions as best as you can, ensuring that whatever concern they have gets taken care of, either calling the doctor or faxing the doctor for them, asking one of maybe like the director of nursing if they can address an issue. That is something you have to deal with, is family issues. Yeah, I think that's pretty much it. I'm just kind of trying to go through in my head little things. I try to help out the CNAs if I can. If somebody needs to go to the bathroom and I'm in the room, I don't mind helping them to the toilet, unless they're a 2-person transfer or something like that, then I always will go get help. But if it's somebody that I feel comfortable transferring, that I've done before, or they're a 1-person assist or something like that, then I don't mind helping out. But yeah, that's about it. At night, I collect those hearing aids back, make sure everybody's in bed. Usually, like the last hour of my shift, most of the residents are in bed, so I do another round of checks. During the day shift too, if I have time, I always like to go kind of in my general area and I'll do a quick check, especially after lunch, just because some people take naps and that's when everybody kind of tends to scatter a little bit. So I like to make sure, kind of do like a mental inventory of where everybody is in my head. But yeah, that's about what I do in long-term care. It can have days where you're just steadily busy all day and nothing major comes up, and then you can have days where everything kind of goes crazy and you're there an hour after your shift just trying to finish everything up. But all I can say is, if you find yourself in that situation, just strive to do the best that you can every single day. You're going to have bad days. You're going to get frustrated with your coworkers. You're going to get frustrated with the residents. You're going to get frustrated with the doctors and the family members. And the biggest thing that helps me through every day is just trying to remember that these are people. Even though it's a job to us, these are people, this is their life. And I always try to think of each resident. What if this is my mom? What if this is my grandma? What if this is me later in life? I just always try to put myself in that situation, and I really think that that helps me put things in perspective, get through the day and handle it better. Even like I said, if I'm having the worst day ever, I've had 2 falls and this family member's really upset about something that I wasn't even here for, it just do the best you can, put a smile on your face. You would be amazed by, having a good attitude, how much better your day runs. It's not always easy, but it really, really does make a difference. But that's basically what I do on a day-to-day basis. If you guys have any more questions, let me know. Like I said, I'm going to try to do day in the life of, those other specialties that I talked about. I kind of have a little bit of a day in the life thing. If you watch my med surge time management video, that kind of talks about what you do day to day on a med surge floor. So watch that if you have any questions about med surge. When I do another med surge clinical, I can definitely do another, more updated video for you guys, especially if I do specialty rotations again, like ACU or ER, I can definitely do something like that. But this video is super long now, so I'm going to go. If you guys have any more requests for me or anything like that, just let me know, and have a great rest of your summer.